Early diagnosis is crucial for effective cancer treatment. While many signs and symptoms associated with cancer can also be present in non-cancerous conditions, staying vigilant is key to ensuring early detection. Let's explore 9 important signs and symptoms that could indicate cancer. Number 1. Unexplained weight loss. Are you losing weight without changing your diet, eating habits, or exercise routine? This could be a sign of cancer due to uncontrolled cell production. Weight loss can also be caused by other conditions, such as diabetes or hyperthyroidism. A weight loss of 10% of your body weight within 6 months warrants a medical evaluation to determine its cause. Number 2. Bleeding. Hemorrhages can vary depending on the tumor's location. For instance, lung cancer might cause coughing up blood, bladder cancer can lead to blood in the urine, and colon cancer might present as blood in the stool. Vaginal bleeding can indicate uterine cancer. Any unexplained bleeding should be thoroughly investigated. Number 3. Skin changes. Be alert to changes in moles or nevi, especially if they grow, change color, or have irregular borders. Melanoma, a severe type of skin cancer, often shows these signs. An increase in size or unusual characteristics in a mole should prompt immediate medical attention. Number 4. Persistent nausea and vomiting. If you experience ongoing nausea and vomiting without a clear cause, such as a virus or food poisoning, it's essential to investigate these symptoms further. Cancer can cause such symptoms by producing substances that lead to nausea. Number 5. Swollen lymph nodes. Lymph nodes may swell in response to infection, but if they swell without an obvious cause, it could be a sign of cancer. Lymphadenopathy, or enlarged lymph nodes, can occur in various cancers and requires medical evaluation. Number 6. Unexplained fever. Fever usually results from infections, but if you experience an increase in body temperature without an infectious cause, it might be hyperthermia associated with cancers like lymphoma or leukemia. Night sweats and persistent fever should be checked by a doctor. Number 7. Growing nodules. Pay attention to any nodules that increase in size, whether they're in the thyroid, breasts, or testicles. Nodules that grow can be a sign of cancer and need to be investigated promptly. Most thyroid nodules are benign, but a medical evaluation is crucial for accurate diagnosis. Number 8. Weakness and fatigue. Unexplained fatigue or a decrease in physical fitness can be a sign of anemia related to cancer. While anemia can also result from iron or vitamin deficiencies, it's important to investigate significant and persistent fatigue. Number 9. Progressive pain. Persistent or worsening pain, such as severe headaches or abdominal pain that intensifies over time, could be indicative of cancer. If the pain doesn't improve with medication or continues to worsen, seek medical advice for a thorough examination. If you found this video informative and valuable, please give it a thumbs up to help others find it too. Your support really makes a difference. And if you haven't subscribed yet, now is the perfect time. Hit that subscribe button and turn on notifications so you never miss out on our latest videos and updates. We'd love to hear from you. Leave a comment below letting us know where you're watching from and any topics you'd like us to cover in future videos. Your feedback helps us create content that matters to you. Thanks for joining us today. Stay informed, stay healthy, and we'll see you in the next video. Take care.